What I need to tell you about amlodipine today could save you from making a mistake that quietly harms thousands of people every year. Because this is one of the most prescribed blood pressure medications in the world, and also one of the most misunderstood. Some people take the first pill, don't feel different, and assume it failed. Others notice swollen ankles, panic, and stop it overnight. And somewhere right now, a senior is staring at a blood pressure machine, wondering whether this little tablet is helping or hurting. I'm Dr. Sarah J. Miller, and if you stay with me through this video, you're going to understand exactly what amlodipine does, what it does not do, what side effects matter, and which warning signs you should never ignore. Subscribe now for clear, life-saving heart guidance that helps you avoid dangerous mistakes, protect your pressure, and stay healthier longer. Before we go any further, I want you to meet Dorothy, because her story reveals the first thing almost nobody explains when this medication is prescribed. Dorothy was 72, careful, intelligent, and very motivated. Her doctor started her on amlodipine after several weeks of high readings. She took her first tablet at breakfast, checked her pressure at lunch, and it was still high. By dinner, she checked again, still high. So the next morning, she did something that terrifies me. She took 2 tablets instead of 1 because she thought the first dose wasn't doing anything. By that afternoon, she felt lightheaded, weak, washed out, and frightened. She thought she was having a serious reaction. What was really happening was not that the medication had failed. It was that nobody had explained how amlodipine actually works. Amlodipine is a calcium channel blocker. And that sounds technical until you understand the simple version. Your blood vessels have muscular walls. When those walls stay tighter than they should, pressure inside them rises. Amlodipine helps those blood vessels relax and widen, so blood can move more easily and your heart does not have to push so hard. That's the goal. But here's the part people miss. It is not a dramatic feel it in an hour and everything changes kind of medication for most patients. It starts working early, yes, but the full blood pressure effect builds over days and often over a couple of weeks. That means if you judge it too quickly, you can convince yourself it's useless, when in reality it is quietly doing exactly what it was designed to do. And that leads to the second dangerous misunderstanding. Treating amlodipine like a rescue pill instead of a steady daily medication. I had a patient named Walter, 76, who only took his tablet on days when his pressure looked high. If it was normal in the morning, he skipped it. If it was elevated, he took it. In his mind, that was logical. Why take blood pressure medicine when the number looks okay? But the reason the number sometimes looked okay was often because the medication had been in his system from the previous days. Not because he no longer needed it. He was turning a long-acting preventive medicine into a random experiment. His readings became erratic, his symptoms became confusing, and neither he nor his doctor could tell what his blood pressure really was. Amlodipine works best when it is taken consistently, because it is long-acting. It stays in the body a long time, which is why most people only take it once a day. That long action is actually one of its biggest advantages. It gives smoother control and makes sudden drops in pressure less likely than with shorter-acting medicines. But that same advantage disappears if you skip around, take it only when you feel like it, or keep changing the time for no reason. This is not a medication you chase numbers with. It is a medication you let build a steady protective effect with regular use. That is how it helps reduce the long-term damage high blood pressure does to the brain, heart, kidneys, and blood vessels. Now let me tell you about Carol, because her story explains the side effect that scares people early and causes many of them to quit before the medication has had a fair chance. Carol was 69 and started 5 milligrams once daily. On day 3, she stood up from the couch, walked into the kitchen, and suddenly felt unsteady. Not spinning exactly, but floaty, off balance, weak in the knees. She told her daughter, "This medicine is not for me." She was ready to throw the bottle away. What Carol didn't understand, and what many people don't understand, is that when blood vessels relax, especially in the beginning. Your body sometimes needs a little time to adapt. That can show up as dizziness, especially when you stand too quickly, especially in hot weather, and especially if you are already dehydrated. If amlodipine makes you dizzy, that does not always mean something dangerous is happening, but it does mean you need to slow down and pay attention. Sit if you feel unsteady, rise gradually from the bed or chair, give your body a moment before you walk. Be extra careful after a hot shower, during summer heat, or after exertion, because those situations can make blood pressure dip more than usual. And if the dizziness is severe, if you faint, or if you feel like you are about to black out repeatedly, that is no longer a casual side effect you just wait out. That is a reason to contact your doctor promptly. The difference between a manageable adjustment effect and a clinically important problem is not bravado. It is honesty about what your body is telling you. But the side effect that causes the most confusion, the one that sends people into absolute panic, is ankle swelling. Let me introduce you to Evelyn. She was 74, active, proud, and finally seeing improvement in her blood pressure after years of bad readings. Then one evening she noticed her socks had left deep marks above her ankles. 2 days later, her feet looked puffy. By the end of the week, she was convinced her heart was failing. She stopped her amlodipine without calling anyone. Her pressure climbed. Her headaches returned, and within 2 weeks, she was in urgent care with readings so high she was at real risk. The swelling was real. The fear was understandable. But what she did next was the dangerous part, because she assumed every swollen ankle while on amlodipine means the medication is poisoning you. Here's what you need to understand about amlodipine-related swelling. Because this is the single most misunderstood effect of this drug. Amlodipine can cause fluid to collect around the ankles and lower legs, especially later in the day, especially in older adults, especially at higher doses, and especially when you're upright for long periods. That swelling is often not the same thing as whole body fluid overload from heart failure. In many people, it is more about how the medication changes pressure in the small blood vessels near the legs, allowing fluid to shift into the surrounding tissues. That is why some people wake up looking better in the morning and look puffier again by evening. It can be mild, it can be annoying, sometimes it can be significant, but it has to be interpreted correctly. And this is where people make the next mistake, assuming the only answer is to stop the drug immediately. Not always. Sometimes the dose is simply too high for that person. Sometimes a doctor will lower it. Sometimes the swelling is bothersome enough that a different medication makes more sense. Sometimes combining amlodipine with another blood pressure medicine changes the picture. But what almost never makes sense is self-diagnosing, self-adjusting, or self-adding random remedies without guidance. Because swelling can have more than one cause, and you need to know which cause you're actually dealing with. Elevating your legs may help a little. Compression may help some people, but if the swelling is new, persistent, worsening, or combined with breathlessness, chest symptoms, or sudden weight gain, that deserves a proper medical review. Now I want to show you the warning sign people are least prepared for, because it sounds backwards. Dennis was 71 and had coronary artery disease. His doctor increased his amlodipine dose. A day later, he began noticing heavier pressure in the chest with walking. He assumed that was impossible. How could a heart medicine make chest pain worse? So he ignored it for 48 hours. That was a mistake. While rare, some people with significant heart or blood vessel disease can develop worsening angina or even more serious cardiac symptoms after starting amlodipine or after a dose increase. And that is why new chest pain or clearly worsening chest pain is never something you sit with and see what happens. When your chest starts telling a new story, you listen immediately. So let me make this very clear, because this is where lives are protected. If you are taking amlodipine and you develop chest pain that is new, chest pain that is stronger than your usual angina, chest pain that spreads to the jaw, arms, back, or neck, chest pain with sweating, nausea, or shortness of breath. You do not wait for the next appointment. And if you faint, if your face or throat begins swelling, if your skin or eyes turn yellow, if you develop severe abdominal pain with vomiting, those are not internet side effects to casually browse. Those are urgent signs. Most people taking amlodipine will never experience these problems. That is true. But the people who do get into danger when they talk themselves out of acting because they don't want to seem dramatic. Let me tell you about Gloria now. Because her story captures a different kind of danger, the quiet danger of feeling better and deciding you're cured. Gloria's blood pressure came down beautifully over several months. She felt proud, energized, relieved. She started telling friends the medicine had fixed her hypertension. Then she made a decision many patients make. She stopped taking it because the numbers had improved. Within weeks, her pressure began creeping back up. She didn't feel it at first, because high blood pressure is often silent. That's why it is so destructive. It can be damaging delicate blood vessels in the brain, kidneys, retina, and heart while you feel absolutely normal. By the time symptoms appear, harm may already be underway. Gloria had mistaken control for cure, and those are not the same thing. Amlodipine controls blood pressure. It does not erase the tendency your body has toward high blood pressure, and that distinction matters more than most people realize. When the numbers improve, that is often evidence the treatment is working, not evidence the problem has vanished. And suddenly, stopping a medication because you feel fine can push your pressure back up again, sometimes without any warning symptoms at all. That means stroke risk rises again, heart strain rises again, and long-term vessel damage resumes, even while daily life looks unchanged on the surface. If you ever think the medicine should be reduced, stopped, or replaced, that conversation belongs with the clinician managing your care. There may be excellent reasons to change it, but I feel okay now is not by itself a safe reason. Now let's talk about dose. Because dose is where fear and misunderstanding love to grow. Many adults start at 5 milligrams once daily. Some people, especially older, smaller, more fragile patients, or those with liver issues, may be started at 2.5 milligrams. And some eventually need 10 milligrams. Patients often assume the higher dose means something is terribly wrong, or the lower dose means their doctor isn't taking them seriously. Neither is true. Dose is not a moral judgment. It is not a scorecard. It is simply the amount your particular body needs to reach benefit without too many side effects. And that balance is individual. The smartest prescribing is not the most aggressive prescribing. It is the prescribing that respects age, physiology, other medications, symptoms, and how your body responds over time. That reminds me of Harold, who kept comparing his prescription to his neighbor's. Harold was offended that his doctor started him on a lower dose than his golfing partner. If he gets 10 milligrams, he said, why am I only getting 2.5? What he was not accounting for was that he was older, lighter, already taking another blood pressure medication, and had a history of getting dizzy with even mild pressure changes. Starting low was not weakness. It was wisdom. When his doctor increased the dose gradually, Harold tolerated it well and avoided the crash that likely would have happened if he had demanded a stronger start. Medicine becomes safer when ego leaves the room. Your right dose is the one that protects you, not the one that sounds more impressive when you say it out loud. Now let's talk about a simple mistake that creates completely avoidable chaos, the missed dose. I had a patient named Paul, 73, who forgot his tablet on Tuesday, remembered on Wednesday afternoon, then took 2 at once because he thought he needed to catch up. By evening, he felt exhausted and dizzy and blamed the medication itself. But the problem was not the medication. The problem was the way he corrected the missed dose. For most people, if you remember later that same day, you take the missed dose when you remember. If the whole day has passed and you're basically at the next dose, you usually skip the missed one and take the next dose at the normal time. What you do not do is double up just because you feel guilty. And that guilt matters more than people think, because it drives bad decisions. There's something about blood pressure medicine that makes conscientious people anxious. They think one missed pill has ruined everything, so they overcorrect. But blood pressure treatment is not helped by panic. It is helped by consistency. Set an alarm. Put the bottle where your daily routine already leads you. Tie it to brushing your teeth or breakfast if that works for you. Use a pill organizer if needed, because the best medication plan in the world fails if real life keeps interrupting it. You do not need perfection. You need a system strong enough to carry you on ordinary, distracted days. That is what keeps treatment effective over months and years, not bursts of motivation followed by confusion. Now here comes the part many people never hear from the pharmacy counter. What can make side effects worse or make the experience more confusing? Grapefruit is a big one for some patients. Large amounts of grapefruit or grapefruit juice can raise the amount of amlodipine in your body and make side effects more likely. Alcohol is another. Can you drink while taking amlodipine? Sometimes yes. But alcohol can lower pressure more than you expected and tip you toward dizziness, sleepiness, or headache. And then there are over-the-counter products, especially the ones people forget to mention. Cold and flu remedies, decongestants, pain products, supplements, herbals. Patients think, if I bought it without a prescription, it doesn't count. It counts. Your doctor and pharmacist need the full picture, not the edited version. I remember a woman named Teresa, who could not understand why her amlodipine suddenly seemed to make her feel worse. She had new flushing, more headaches, more lightheadedness. After a lot of back and forth, the real clue appeared. She had been drinking grapefruit juice every morning because she thought it was a healthy change. That's how subtle this can be. Sometimes the problem is not the prescription itself. It's the new habit around the prescription. The same goes for drug interactions, and this is where honesty becomes safety. Antibiotics like clarithromycin, antifungal medicines, drugs such as diltiazem, immune medicines like tacrolimus or cyclosporin, and simvastatin are all examples that may need attention. You do not need to memorize a pharmacology textbook. You just need to tell your care team everything you take. And please hear me on this next point. Because it is one of the biggest emotional traps in blood pressure treatment. Some people take amlodipine exactly as prescribed and then become discouraged because they don't feel the blood pressure coming down. That's normal. High blood pressure is often symptomless. You are not supposed to feel fireworks when the medication works. In fact, the absence of a dramatic sensation is often the point. The medicine is reducing pressure inside vessels you cannot see, easing work your heart has to do, and lowering long-term risk you cannot measure with feelings alone. That is why the home blood pressure log matters. Not because you should obsess over every number, but because objective data tells you what subjective sensations cannot. Now let me tell you about Marie, because her story reveals a misunderstanding that can become dangerous very fast. Marie had both hypertension and angina. Her doctor prescribed amlodipine partly to help reduce episodes of chest discomfort over time. One afternoon, she developed sudden chest pain while walking to her mailbox. She sat down, took her regular amlodipine tablet, and waited for it to rescue her in the moment. That's not what it's for. Amlodipine helps prevent angina episodes over time by improving blood flow conditions and lowering the workload on the heart. But it is not the pill you take for sudden active chest pain, hoping it will immediately shut it down. And thinking that way can delay emergency action when emergency action is exactly what is needed. So if your doctor has given you a separate rescue medicine for chest pain, you follow that plan. And if chest pain is severe, different, longer lasting, or accompanied by shortness of breath, sweating, nausea, or faintness, you seek urgent help. Do not confuse prevention with rescue. Do not confuse daily control with emergency treatment. That distinction is not academic. It changes outcomes. Many people hear that amlodipine also helps angina and assume that means it functions like an instant switch. It does not. It is more like a pressure-reducing background protector. Not a siren response. The problem with medication misunderstandings is that they sound harmless until the day you need to act correctly under stress. That is why I'm spelling this out so carefully now, before that moment ever arrives. There's another question patients ask in a whisper, and I understand why. Doctor, is this medicine harming my heart if it makes my heartbeat feel stronger sometimes? Amlodipine can cause palpitations or a pounding sensation in some people, especially early on. That can be unsettling. It can feel like the heart is trying to tell you the medicine is wrong. But not every skipped beat feeling or pounding moment means danger. What matters is the pattern. Is it brief or persistent? Mild or escalating? Does it come with chest pain, fainting, severe breathlessness? Or a sense that something is very different from your baseline? If yes, report it promptly. If it's mild and temporary, it may settle. But what you never do is hide it because you're embarrassed or because you think you're supposed to tough it out. Then there's fatigue, the side effect that gets blamed on aging, poor sleep, weather, grandchildren, anything except the new medication. Sometimes amlodipine can make people feel more tired or sleepy. That doesn't happen to everyone, and often it improves. But if you become unusually wiped out after starting it, don't just quietly suffer. Talk to your doctor. Sometimes a lower dose helps. Sometimes a timing change helps. Sometimes the medication is fine and something else is going on entirely. Anemia, dehydration, another drug interaction, poor sleep, or a blood pressure that has dropped too low for you. The danger is not that every symptom means amlodipine is wrong. The danger is assuming every symptom must be either completely harmless or completely catastrophic. Good medicine lives between those two extremes. Now let me show you what effective treatment really looks like. Because this part brings peace. Effective treatment does not mean perfection. It does not mean you never have a reading that runs a little higher than you hoped. It does not mean you never have a day when you feel slightly off. Effective treatment means your average pressures are improving, your side effects are tolerable or manageable, and the overall balance is moving toward protection rather than damage. That may sound less dramatic than the internet promises, but it is real medicine. Real medicine is steady. It is patient. It is measured, and with a drug like amlodipine, that steady quality is one of the main reasons doctors use it so often. It can fit into long-term treatment plans in a way many patients end up tolerating very well. I want you to meet Leonard, because his story shows what happens when people stop fighting the process and start working with it. Leonard was 78, skeptical of every medication, and certain that if he just walked more and cut out salt for a week, he could avoid prescriptions entirely. Lifestyle changes helped, yes, but his blood pressure was still too high. He finally started amlodipine and spent the first 10 days looking for signs it was ruining him. A warm face one afternoon, mild swelling one evening, slight dizziness when he stood too fast. He was ready to quit. Instead, he documented what happened, checked his pressure calmly, hydrated better, slowed his position changes, and reported the symptoms accurately. 2 weeks later, the dizziness had eased, the pressure had improved, and he realized something profound. Fear had nearly robbed him of a treatment that was helping. That does not mean lifestyle changes stop mattering. And this is another place people get confused. Medication is not permission to ignore salt, weight, activity, stress, smoking, sleep, and alcohol. Untreated hypertension is rarely caused by one single thing, and controlled hypertension is rarely maintained by one pill alone forever. Amlodipine can be a powerful tool, but it works best as part of a larger heart protection strategy. Walk if you can. Eat in a blood pressure-friendly way. Keep your follow-ups. Track your numbers without spiraling over every fluctuation. If you smoke, make quitting a real project. If alcohol makes you dizzy on this medicine, cut it down, or stop. And if stress is constantly pressing on your body, treat that seriously too. Your arteries live inside your life, not outside it. Now let's talk about when to take it, because people ask that constantly, morning or night. With food or without? The truth is simpler than most people expect. Amlodipine can generally be taken with or without food. What matters most is taking it around the same time every day so the habit becomes automatic. If it upsets your stomach, taking it with food may feel better. If it makes you a bit drowsy, some people prefer evening, though many take it in the morning without issue. The perfect time is usually the time you can actually stick with, not the time that sounds best in a comment section. Consistency beats theory. Choose a routine your ordinary life can support, because blood pressure control depends far more on adherence than on chasing the most fashionable timing strategy. And while we're being practical, let's talk about blood pressure monitoring, because patients often assume starting amlodipine means checking obsessively all day long. No, please don't do that to yourself. Repeated anxious checking can distort your readings and your peace of mind. Measure correctly at consistent times in a rested state and keep a simple log. That is useful. Checking every hour because you're frightened is not useful. It turns treatment into surveillance, and surveillance into anxiety. Then anxiety raises pressure, and suddenly you think the medication is failing, when what's really failing is the emotional environment around your measurement. Your doctor needs trends, not panicked snapshots. There is a big difference between engaged self-monitoring and living as if every number is a verdict on whether you are safe. I also need to say something important for caregivers and family members, because sometimes they accidentally make this harder. If your mother, father, spouse, or grandparent starts amlodipine and mentions a side effect, don't jump immediately to stop taking it right now. Ask better questions. How severe is it? When did it start? Did they stand up too quickly? Is the swelling mild or dramatic? Is there chest pain, fainting, trouble breathing, or signs of an allergic reaction? The goal is not to minimize symptoms, but to respond proportionally. Calm observation plus timely medical guidance prevents a lot of harm. Panic creates two opposite dangers. People stop medications they needed, or they ignore symptoms they should have acted on. Family can be a stabilizing force or a multiplier of fear. Choose stability. Now let me tell you about Irene, because her story captures what good follow-up looks like. Irene was 75 and had newly diagnosed hypertension. She started amlodipine, wrote down her blood pressure readings twice a day for 2 weeks, noted mild ankle puffiness in the evenings, and brought the whole record to her visit. Because the information was clear, her doctor could actually think clearly. The pressures had improved, the swelling was mild, there was no breathlessness, and her morning ankles were nearly normal. Instead of making a blind decision, her doctor adjusted the broader plan thoughtfully. That is how this is supposed to work. You and your clinician are not enemies across a prescription pad. You are partners trying to reach a stable, safe, long-term outcome using real information instead of guesswork. Your health does not need panic. It needs understanding. It does not need internet myths. It needs clear decisions. And if you are taking amlodipine now, or thinking about starting it, I hope this video has given you something more valuable than reassurance alone. I hope it has given you a framework. Know what the medicine does. Know what side effects are common. Know which warning signs are serious. Know that consistency matters. Know that stopping on your own can hurt you. And know that with the right guidance, this medication helps many people lower risk they cannot otherwise see. Share this with someone who takes blood pressure medicine, because one misunderstanding can lead to a dangerous choice. Take care of yourself, and I'll see you in the next video.